Breast cancer, like any other cancer, is a devastating thing. It's something that will not love it happen on anyone. Cancer, and breast cancer in particular, is something that we can actually prevent, even though at times, no matter what you do, if it shows that you have to get this disease, you will. But there are things you can do in order to avoid you getting this disease, in order to reduce your risk of getting this deadly disease. Hello everyone, thank you so much for joining us on this live discussion where we are discussing breast cancer awareness, that is talking about breast cancer and especially how you can do to reduce your risk of getting breast cancer. Remember, this is October, in which we discuss breast cancer. October is actually a breast cancer month. It's a month dedicated to discuss on breast cancer in particular and cancer in general. So if you are joining us, welcome, thank you so much. Please, if you are just joining, don't forget to share. Now, let us begin this discussion in the name of the Almighty, most merciful, most glorious. May the peace of the Almighty be with you. May the peace of the Almighty have mercy upon you. May the peace of the Almighty guide and protect you. Thank you so much. So we are going to be looking at breast cancer, where we will look at the points that you will need to take in order to reduce your risk of getting breast cancer. Sister Mary, welcome. Thank you so much. How are you doing? So we are going to look at points that you will need to do, things that you need to do in order to reduce your risk of getting breast cancer. We should take note that breast cancer, for you to reduce your risk, there are simple things that you need to do. You don't need to maybe get something that is so expensive for you to reduce breast cancer. You just need to do simple things around you, and these things, once you do them, you see that you're going to avoid something devastating in future. Hey, Mr. Cliff, welcome, bro. Thank you so much for being here. So you see that these things, when you do them, it reduces your risk of you getting breast cancer. So what are these things? These are what we will be talking about. And it will also interest you to know that most of the breast cancer cases are being detected by you at home. So most of the people who have breast cancer, more than 50%, they actually discover something within their breast before they went to the hospital. So it is important that we all take this precaution on how we can do to reduce our risk of getting breast cancer. So we are going to go down this. There are about 7 points here which we're going to discuss. The very first point is self-breast examination. Self-breast examination. So you need to constantly do your self-breast examination. Self-breast examination is actually one of the highest ways of you detecting breast cancer, and more than 50% of breast cancer situations, breast cancer cases, have been discovered through self-breast examination, which you need to stand in front of the mirror, observe your breast, make sure that they are of sizes that you understand. So you need to do this constantly in order for you to even understand your normal breast, because self-breast examination will guide you, will help you to understand that this is my normal breast and this is my abnormal breast. So if you know that this is your normal breast, for example, you already know that your left breast is bigger than the right breast, or your right breast is bigger than the left breast, by the time you get now to the mirror, maybe next month, and you are seeing that the breasts that were bigger than the other breast, maybe the left breast was bigger than the right breast, but now the right breast is now bigger than the left breast. What is it telling you? It's telling you that there is something wrong with the right breast. That is why it is now bigger than the left breast. Because generally, most ladies don't have the same size in terms of their breast. Most ladies, one of the breasts will be bigger than the other. That's how the human system is. And if you are breastfeeding, if you're a breastfeeding mom, obviously, one of your breasts will be bigger than the other. During menstruation, obviously, one of your breasts will be bigger than the other. So the very first point here, in order for you to avoid breast cancer, is that you do self-breast examination, which entails that you stand in front of the mirror, observe your breast, know the normal size of your breast, and once you know this, by the time you're doing it constantly, you will understand that there's something wrong with your breast, such that you visit your doctor. So this is very important. And once you do this self-breast examination, if you observe any strange item in terms of the size, in terms of the feeling, in terms of maybe your nipple, then you report to your doctor for thorough examination. On self-breast examination, how to do it, there is a link in the description which I'm going to put up for any person who would love to check the video on how to do your self-breast examination. The next thing which you will do in order for you to avoid breast cancer is that you avoid smoking. So if you want to avoid breast cancer, you need to avoid smoking. Smoking, which we are talking about tobacco here, tobacco is actually the highest product that will expose you to have cancer in general and breast cancer in particular. So tobacco smoking is the highest product that will expose you to have cancer in general and breast cancer in particular. So if you're a smoker, please, the best thing is to stop smoking. The next point that will help you in reducing breast cancer is you limit or you avoid alcohol. You limit or you avoid alcohol. So if you drink too much, please limit the way you drink. If you can avoid it totally, that would be the best for you. So you limit or you avoid alcohol is going to improve your health and also help you in terms of you avoiding breast cancer. Hey, Mr. Fonja, greetings to you, bro. Thanks so much for joining. Please, for any person who is just joining, please don't forget, just help share this video out. Thank you so much. So we are going through things that you need to do. Hey, Sister Sidone, welcome. Thank you so much, sis. How are you doing? So we are talking about things that you need to do in order for you to avoid breast cancer. So what are those things that you need to reduce your risk in order for you to reduce your risk of getting breast cancer? What are those things that you need to do? So we said the first one is that you need to do your self-breast examination. Please, if you want to learn how to do your self-breast examination, please check in the description. We're going to put a link there when you learn how to do that. Hey, Sister Aisatu, welcome. How are you doing? So you do self-breast examination is the first thing. The second thing is that you avoid smoking. You stop smoking. That's the best thing to do. The third thing is that you need to limit or stop alcohol. The fourth is that you need to control your weight. Yes, Sister Aisatu, welcome. Good evening to you. I hope you're doing great. Please, if you are just joining, don't forget to share this video. Thank you so much. So the fourth is that you control your weight. Now let me talk a little bit about your weight. When we talk about controlling your weight here as a manner of you reducing breast cancer, reducing the risk of you getting breast cancer. Weight here, we are talking about you knowing your BMI. Weight is, for somebody could be 100 kilograms, but the weight is okay. Please, we should not get this wrong. Somebody could be 100 kilograms, but the weight is okay. While some other person could be just 70 kilograms, but the person is overweight. So we need to understand it. Sister Glory, welcome. How are you doing? So we need to understand this, that when we talk about weight here, we are talking about healthy weight, that you need to gain weight healthily in order for you to reduce your risk of getting breast cancer. How do you get healthy weight? How do you know that your weight is healthy? Please, if you are just joining, just help us share the video. Thank you. Sister Aisatu, thank you so much for sharing. How do you know that your weight is healthy? You need to take your weight, you measure, you take your weight divided by the square of your height. So you take your weight divided by the square of your height. The answer, when you get the answer, please, if the answer is between 18 right up to 25, then your weight is okay. But if the answer is below 18, then you're underweight. If your answer is above 25 right up to 30, you are overweight. If your answer is above 30, you are obese. You are obese. So those are that is the criteria for you to know that your weight is healthy. Well, sister, I said no, you can still cut down weight. The only issue with this food aspect is that you control what you eat. I've said that several times, that for people who want to cut down their weight, and if you want to cut down weight, make sure that you just look at what you eat, the time you eat, and how you eat. With that is going to help you cut down this weight. Okay, so just try. It cannot be more than you. It cannot be more than you. Please, if you're just joining, you're welcome. Thank you so much. Please don't forget to share this video. And if you have a question, please just send it up. We are discussing breast cancer. We are discussing how you can reduce your risk of getting breast cancer. So we have mentioned the very first one, self-breast examination, in which you examine your breast as a person. You don't go to the hospital to do that. You do that alone. Then the next thing is that you control your weight. The next thing is that you avoid smoking. The next thing is that you reduce alcohol intake, or you stop it. The next is that you breastfeed. This is important because, you know, when you get pregnant, you start thinking of how you will get artificial breast milk for your child. Okay, breastfeeding is actually a way of reducing your risk of breast cancer. I hope it's clear. Breastfeeding is actually a way of reducing your risk of getting breast cancer. So please, if you're pregnant, why not breastfeed even for 1 year plus? Breastfeed your child and have that burden, as well as also reducing your risk of getting breast cancer. So breastfeeding is a way in which, if you want to reduce breast cancer, you need to breastfeed. The next is you need to be physically active. You need to be physically active. Physically active, you are talking about somebody who do physical exercises like sport. If you are a farmer, you go to the farm, obviously you reduce your risk. So you need to be physically active. So don't just stay at home. I know we have mommy's daughters around. You wait for everything to be done, right? And you just eat and you take your phone, you browse. Please, being physically active helps reduce your risk of getting breast cancer. So please, be physically active if you want to reduce your risk of getting breast cancer. The next is that you avoid exposing yourself to radiation. What we are talking about radiation here, we're talking about something like when you go to the hospital and you're asked to do X-ray, right? You're asked to do X-ray. So X-ray are radiation that have to penetrate your body and even your bones. That's why you're able to see your bones through. So avoiding radiation is another way of you reducing your risk of getting breast cancer. So if you avoid radiation, it reduces your risk of getting breast cancer. And even the sun as well. The sun has the UV light. The UV light has to do with radiation. So if you sit continuously under the sun, you're actually increasing your risk of you getting cancer, and breast cancer in particular. All of these points we are giving in order for you to reduce your risk of getting breast cancer are the same points that you also need to reduce your risk of getting other type of cancer. So if it is cervical cancer, lung cancer, colon cancer, blood cancer, prostate cancer, any of these, all the points except for self-breast examination, which therefore means that what? Stopping tobacco, that is smoking, is one of the best ways to reduce your risk of getting breast cancer and cancer in general. Getting a healthy weight is one of the best ways to reduce your risk of getting cancer and breast cancer also in particular. Controlling alcohol or stopping alcohol is one of the best ways of you reducing your risk of getting cancer and breast cancer in particular. Breastfeeding and Self-breast examinations are exceptions that are particular when it concerns breast cancer. But all the other points we've mentioned, that is, do not smoke, control your weight, limit alcohol intake, all of this reduces your risk of getting cancer in general and then breast cancer in particular. The next point that will help you reduce your risk of getting cancer and breast cancer in particular is that you need to understand your family history. So you need to know your risks and understand your family history. Now I want to talk about family history here. Your mom might have had breast cancer before. Maybe your sister might have had breast cancer before. Maybe your aunt might have had breast cancer before. So if you're from a family where breast cancer is common, then you need to understand that in order for you to reduce your risk of getting breast cancer. So if you're from a family where breast cancer is common, please, you need to make sure that you do all you can in terms of doing the other things so that your risks have to come down. I think with this, we are good to go in terms of knowing what to do in order to reduce the risk of getting breast cancer. Please, if you are just joining, you're welcome. Thank you so much. We are discussing breast cancer. We are discussing breast cancer awareness because this is the breast cancer awareness month. We are discussing what you need to do in order for you to reduce your risk of getting breast cancer. And we have talked about some points here which I will still go through. Please do not forget to share this video. If you're just joining, don't forget to share this video. Help share to your friends. Help share to your other groups. So we have discussed the very first point is self-breast examination. And I said, please check the link in the description of this video. We are going to put the link there on how you do self-breast examination and other breast cancer risk. So you do self-breast examination is going to help you to actually reduce your risk of getting it, because with self-breast examination, you're going to understand the shape of your breast and understand if there's any changes. There are a lot of things you learn when you do your self-breast examination in terms of how your nipple look like, what is the color of your breast, what is the shape of your breast, what is the size of your breast, all of that. With self-breast examination, you're going to understand all of that together. And please, if you have any question, just put as we are discussing so that it can be answered. The next point we have discussed already is that do not smoke. If you're a smoker, please stop smoking. Stop smoking. Smoking is the highest risk factor when it concerns cancer. There is nothing that beats tobacco. Tobacco is the highest thing that causes cancer, and breast cancer also in particular. So please stop smoking if you want to reduce your risk of getting breast cancer. Stop smoking. That is the best thing you can do. The next thing is that you need to control your weight. Control your weight. Controlling your weight is actually a good thing. And I've said that controlling your weight here has to do with you having a BMI that is within normal. The normal BMI falls between general to averagely 25. In some books it's 18.5 out to 25.5, but averagely 25. So if you're having above 25, let me say having 26 for BMI, you're overweight. If you're having 26, and for you to know how to calculate your BMI, you take your weight divided by the square of your height. Let me quote an example. What is your weight? Let me say you weigh 100 kilograms, right? And your height is 2 meters, isn't it? So if you weigh 100 kilograms and your height is 2 meters, what do? You square that height. 2 meters times 2 meters. So a square is multiplying something by itself. 2 times 2 is 4. So 2 meters times 2 meters is 2 meters, right? You keep it under, then you take that weight 100 kilograms. So you have 100 divided by 2 times 2, which is 4. So you have 100 divided by 4, which is 25, isn't it? So you have your BMI as 25, and your BMI of 25 is just about okay, which means there is nothing to worry about more about that. Then the next we'll talk about concerning how to reduce your breast cancer risk is that you limit alcohol or you stop it. Avoid alcohol or you limit it. Okay. Either you avoid alcohol intake or you stop it completely. Yes. The next is breastfeeding, and I've said that this should be added advantage to our ladies. Okay, you need to breastfeed in order to reduce your risk of getting breast cancer. The next is that you need to be physically active, so you have to be physically active. If you're somebody, you have your car, you have a private car, you move in, please. There are days that you decide to walk. Okay, just walk. Or if you know you can do maybe at least jumping once a week, it's going to help you in terms of you being physically active. The next is that you need to avoid exposing yourself to radiation. And the last is that you need to know your risk, know your family history. So with this, we are going to we've understood how we can reduce our risk of getting breast cancer. If you have any question, please, I'm going to give 2 minutes for that. If not, we're calling this short. Thank you so much for following. Sister Glory, thank you so much for being here. Sister Isato, thank you so much for being here. Brother Fonja, thank you so much for being here. Sister Marie, thank you so much. I think you're one of the first person who joined. Brother Cliff, thank you so much for being here. Sister Tazo, thank you so much for being here. So if you have any question, please go ahead and ask your question, please. If you have any question, please can you go ahead and ask your question? Please, if you have any question, can you go ahead and ask your question? Okay, no question. Thank you so much for being here. May God bless you. Don't forget to share this video. Don't forget to follow me on YouTube. Check your health and maintain your wealth. Thank you so much. May God bless you. Have a wonderful time.